And now we are live.
Good afternoon, everyone. We welcome you to the Pillar 4 Committee for our January 27th meeting. Today's topics include all things around community schools connected to Towson University, our outlook on community schools through MSDE, and then also the consortium on coordinated community supports that have been doing a lot of work connected to those schools and other schools across the state. We'll introduce all of those guests later, but first I will just introduce myself. I'm Hope McGuire, Chair, and currently Supervisor of Community Schools in Montgomery County Public Schools. I'll pass it now to Ellie.
Hi, everyone. I'm the vice chair, and I am the director of the Maryland Out of School Time Network. We are also the backbone for the Maryland Coalition for Community Schools. And I can't see, oh, there we go. I will pass it to Dr. Grant.
Good afternoon. I am Jessica Grant, principal of a K-5 comprehensive school in Prince George's County, and I will pass it off to Miss Shalita Jones.
Hi, my name is Shalita Jones. I am a shared accountability specialist for MCPS and also a speech language pathologist. I will pass it to Mr. Mako. Mako, sorry.
Hey, that's right. I'm just Mako. I work as a education program officer at the Able Foundation, and I'm also a board member for the Accountability and Implementation Board. And then I guess I'll do I pass it back to you, Hope, or to
The next
Mitzel.
one, Dr. Mitzel.
Okay, sorry, Dr. Mitzel, I'll pass it to you.
Good afternoon. I'm Dr. Ed Mitzel. I am adjunct faculty at Goucher College, public educator, Baltimore County, live in Carroll, represent Carroll County, worked across the state, Maryland State Department of Education, and also doing education consulting and school leadership and school improvement. Nice to see everyone. I'll pass it back to you, Ms. McGuire, or is there
Yes.
someone else? Okay, off.
We're good. And so at this time, we'll go into any AIB updates before we get started with the different guests we have today.
Thank you, Chair Hope, and Happy New Year to our viewers and our special guests today. This is a great time for AIB updates as we are having our first board meeting of the year on Thursday. And at that board meeting, you can expect to hear about the progress monitoring conferences and the feedback. And we will be sharing overall themes and trends from that feedback. And then mainly with the AIB right now, we are gearing up for legislative session that has begun. And we are preparing testimony and comments. And also we are closely watching a few bills as well as waiting for bills to be introduced. And those are the updates.
Thank you. So we're going to go ahead and get started right into our agenda. The first person we have up is Dr. Schiller, who is here on behalf of the Maryland Center for Community Schools at Towson University to talk a little bit about the center, the certification pathway, and the research that they have been doing recently.
Oops, sorry, I was muted. Thanks, Hope. Nice to see everyone on the call. Hope you're staying warm, safe, dry, all the things. It's really been quite a storm out there. I appreciate the opportunity to talk about the Maryland Center for Community Schools. And for those who don't know me, I'm Jessica Schiller, professor of education at Towson University, and also the director of the Maryland Center for Community Schools. And I prepared some slides. I don't know if that's something you'd like me to share.
Sure.
Yes, you
Yeah.
can share, Professor Schiller. I gave you.
Okay. Oh, great, great. Thank you so much. I see that
welcome.
now. Awesome. Okay, great. So can you see that? Can everybody see that?
Yes.
Okay, excellent. All right, so I'm going to talk a little bit about the center and highlight the things that I've been asked to highlight, but there's more to say, so I'm happy to take questions about our work. So just a little bit of a background and how we got started. The Maryland Center has not been around for super long, about a year and a half. We started in July 24 with some state funds. And we have two major goals that we work on. One is to provide professional development to those in the work of community schools at the district and school level, and to do research and to try to understand the impact of the initiative. And so we've been going since July 24th on fire with all that stuff. We have launched a certificate program for community school staff, which I'll talk about in a minute. We have professional development at all levels for district leaders, like I said, for community school coordinators, new community school coordinators, experienced ones, principals, teachers. We host a big convening every year. We have online resources. We work very closely with MSDE and trying to support the professional development and the research, understanding the initiative. And then, we're working to build our own capacity and the capacity of others in the work. So just to go into a little detail on the certificate program, and it's ironic that's what I'm going off to teach the class with the certificate students in a little while. So we've had this certificate program for some time, and actually once I stop sharing, I'll pop the link in the chat so you can read about it a little bit more. But we have this 4-course post-baccalaureate certificate program in what we call community engagement and leading school change. It is really targeted for those in community schools work. It really helps folks, I think, do some deep reflection and really understand the work of family and community engagement, how to use data in an inclusive and actionable way, and how to be the drivers of positive change in their schools. So we have our second cohort this year, and these are folks statewide. We have, participants all the way from Western Maryland to the Eastern Shore, everywhere in between. Our cohorts are kind of intentionally small, but we've been, every year they're growing. We will recruit again in April for fall 26. So if you know folks that are interested, or if you want to pass the information along, like I said, I'll drop the link in the chat in a few minutes. We've had a lot of success. Folks are giving us positive feedback on the experience. I just threw in a couple of quotes here from some of our students. We have actually a couple of them presenting at our conference this year in March. So it's exciting. They're great cohorts. They're learning a lot. And it also, for us, kind of professionalizes the work, or we're thinking about that as we move forward. What could a certificate look like, and how could it correspond or lead to some kind of, salary gain or, improvement in title or whatever it is. We haven't gotten there yet. But we'd like to think about that. The folks in the program now are doing this as part of their professional development work without that necessarily from their districts. So that just also speaks to how committed community school folks are, but also that this is a program worth doing. Otherwise, we probably wouldn't get students in the program. So I feel really good about that. But in terms of our research, which was the other thing I was asked to kind of talk about today, I want to just highlight a few things. We've been conducting research for the past couple of years. Last year, we did some work on statewide data in attendance and chronic absenteeism, as well as in school climate, looking at the school climate survey. We have noticed Big drops in chronic absenteeism, continued progress in attendance statewide with community schools versus non-community schools. Also progress around school climate, students reporting feeling more supportive, more connected in their schools than in non-community schools. And then thirdly, we did a big analysis of the asset and needs assessment that those come in every year, and we looked at the ones from last year, about 150 of them or something like that, from all over the state, to really try to understand what they told us around community partnerships. We gave our report to MSDE, but the sort of high level view was that there's an incredible amount of partners and partnerships being forged through community schools, an incredible amount of needs being met that wouldn't otherwise, all the way from mental health to food, and on, as you might guess. We also engaged in case study research in 2 districts. So we have a busy research team that works to do all these things. Our case study research, we presented the results of that in December to the 2 school districts that participated, and we're about to release our research brief that will share the findings of that case study research at the end of February. So please look out for that. But as you can see, there's like qualitative and quantitative research happening on our end, because we have a great team of folks who have skills in all those areas. This is our crew. Actually, at least one person has cycled off because they got another job. But in any case, we have a big team. This is an interdisciplinary and also interinstitutional team. So a bunch of these folks work for Towson, but some don't. We have folks at Morgan, at Notre Dame, at College Park. That is important to us, as the community school is an interdisciplinary place that brings all kinds of partners and people and roles together. Same for us. And so this is our research team. You can find on our website these research briefs that give you a little more detail into our research. And like I said, I'll throw these links in the chat in a moment. But this is our website, and you can find those briefs there. This is just, some more on our ANA analysis. So you can see kind of, this is just a clip from our report, this much longer report that kind of tallies what was going on here with all these asset and needs assessment, and what we can learn and find from understanding what the data looks like across the state. Which I have to say, again, is very, very interesting and engaging to see how hard people are working, how many partnerships are being forged, and how many needs are being met in our communities across the state. So this is just to give you a gauge on kind of what those supports look like. And with our case studies, we completed a research in the summertime, but we've been working hard to kind of, cull that together. Just to give you, again, a high level view, community schools are really highly engaged with families. Our coordinators are using data. They're building strong relationships. All the key practices are being enacted. Students and families are actually feeling a great sense of belonging at their schools. And that's really encouraging too. There's certainly room to grow in terms of meeting everybody's needs all the time, being really strategic and planning forward. These are, areas of growth, and everybody is contending with the larger context of ICE and the anti-immigrant sentiment that's out there, and that is impacting attendance data, it's impacting academic data, and it's impacting the work itself and what it looks like. So I don't want to sort of, under discuss the larger context because that's important too. But we presented this data back to, or the findings back to the school districts, really engaging in research practice partnership. That's really important to us to not just keep the data, but to share it back. That was very well received, and we want to continue doing these kinds of case studies around the state. We will have our big convening on March 18th. This is where community school folks from all over the state will share kind of homegrown local knowledge with each other. We give awards to community school folks who are working hard and are nominated by their peers. And we're really excited about that upcoming event. And so I'm just going to stop sharing there and take some questions. I will throw that link to the certificate program in the chat so you can learn more about that. But I'm happy to, I'm here for a little bit if folks have questions.
So for the committee, is there any questions for Ms. Schiller? No, I think you did a great job. Thank you.
Well, thank you. Appreciate it. That's the link to the certificate program. If you want to check out our website, you can also go to that link and check that out. And please don't hesitate to reach out if you have any questions about any of the stuff that I mentioned or other things.
Oh, we do have one question. Go right ahead, Joe.
Yeah, this actually isn't a question, but I just wanted to thank you, Dr. Schiller, for really all of your work on this. I think, community schools is I think very, very near and dear to many of us on this call. And I think, what you said is absolutely correct. I think this is helping to kind of professionalize the field. It's helping to build more research and more knowledge and muscle, and really like elevating all of our practitioners in the field. So, and I know just like from the, working to build this program from the ground up, I think you and the team have just done outstanding work, and just wanted to elevate that and thank you for everything you're doing.
Thanks for those words, Joe. I really appreciate it. It's not easy work, but we love it and we think it's really important. And when you go out into schools and see what's happening on the ground, you can't help but be really blown away by the kinds of effort that folks are putting into to help one another. So yeah, the work carries on, and I'm really happy to engage with you all. And again, if there's anything else, please don't hesitate to reach out. So thanks for the opportunity.
Dr. Grant.
Yes, again, not really a question, but I've really enjoyed hearing about the focus on the asset and needs assessment as opposed to focusing on the funding so much.
Oh, yeah.
In my district, it is always constant discussion around what can be purchased with community schools funding rather than using this standpoint that you're talking about, the asset knowledge of our community, and then using that needs assessment to really grow the program, and not just limiting the conversations to what you can pay for or not pay for. So I intend on sharing this information with my community school coordinator because it can certainly develop our program to become one much stronger than what it is.
I appreciate that, Dr. Grant, because for us, what's one thing that's very important is not to be super compliance focused on the, you know, thinking of this as like extra funding and that's it for, purchasing materials or programs or whatever. We see this as a transformative strategy for public education in the state. This is a way of engaging families and community partners and students in work that would really orient our schools around the whole child, and really thinking of what we do every day in a new and transformative way. So I hope that that happens in all of our schools. And so, we'll keep beating that drum, but I appreciate your support.
Thank you so much. As someone who is intimate to this work right now, I would say the biggest thing is this allows us to understand that we're not doing apathy, we're doing empathy, but we also are building capacity, not dependency. A lot of times what we do is just build dependency on others to do for us. The community school strategy is to see the assets within the school, in the community, that builds everyone's capacity to solve a problem, whether funding is there or not. And it will probably be even more telling later on as we look at this data around funding that it was the asset needs assessment that was done strategically that got more to align those funds in a more efficient manner. And I think that is what a lot more people will learn going through the professional lens of it through the Towson University, but then also working with our next group as I segue, because I'm pretty good at that, which is our two colleagues from the Maryland State Department of Education Community Schools Office. We have with us Executive Director, Mr. Derek Anderson, and Education Program Specialist, Ms. Jenny Torres, who will be coming to us to kind of give us an outlook on what community schools has been doing around our school reporting tools and district implementation plans as we continue to get even more structured and aligned across the state. I'll turn it over to you.
Thank you, Hope. Good evening, afternoon, everyone. Like Hope said, joined this afternoon with our coordinator, Jenny Torres. We appreciate the opportunity, as Hope did request some information about the community school reporting that our community schools underwent starting last summer, leading into the fall, and then some information about the countywide implementation plans, also relatively new for our community schools. Just following up or piggybacking on the conversation that was just had. This is not only informative to groups like this and other state leaders, but also informative, probably more importantly so, to those implementing in their respective districts and at the school level. So this is meant to be more of a high level overview, but we welcome questions along the way. And there'll be time built in for questions as we on the front end talk about the reporting, and then on the back end of our time, talk about the countywide implementation plans. So to get things started, we're going to do a couple of things. First, take a look at some high-level data that was submitted to our office over the course of the past several months. Look at some priority areas based on where the investments were made. These are statewide trends, looking at our state as a whole. We'll explore the framework for this countywide implementation plan, which is new for community schools. It came out of as a result of last year's legislative session. And then lastly, just some future initiatives and looking ahead to our ongoing work. I think it's important to reflect a little bit before we get to the present of where we are with the community school reporting. I mentioned that this is new, but I think it's important for the context of we collected individual school data from what were last year, 615 community schools. So in order to do that, we facilitated technical assistance webinars just to get everyone on the same page and kind of level set in regards to what's being reported and how it was going to be reported. In addition to those webinars, we also had office hours just because there are a lot of nuances. There are a lot of, what about this set of circumstances from my school or my district that we wanted to be able to address, but also provide some level of consistency in hopes of having a consistent measure or reflection of the data being reported from school to school and district to district. Early on, as that window opened up for the reporting, we learned specifically from our larger districts that having that final expenditure data was difficult to get by August 15th, which was the date indicated on the legislation. So based on that feedback, we extended that deadline specifically for the fiscal data because that gave, again, primarily the larger districts, but some of our medium-sized districts as well, the opportunity to close their books, gather that data, and prepare it to be submitted for this community school reporting. Again, all of the other data that was collected was provided by and large by August 15th, but specifically the expenditure data came later again, so that LEAs and some of our larger districts had the opportunity to close their books, because in some cases there were still some outstanding charges, balances, purchase orders, etc. Based on all of the data that we collected, and as a reminder, this was a reflection of the 24-25 school year, we had a little over 340 students enrolled in our community schools across the state. Of those students enrolled in our community schools, nearly 90% were identified as needing one or more wraparound services, just really demonstrating the variety of needs that exist within some of our school communities and those schools implementing the community school strategy. For the last fiscal year, collectively, there was a little over $208 million that was actually spent across all of our community schools, compared to just under 230 that was allocated or budgeted within any given, well, as a collective. So that leaves, around 20 million, but that is broken up amongst LEA, amongst schools. And again, this is aggregate data looking at our state as a whole. The reason for any unspent funds can vary widely, which is why we really look to communicate and collaborate with our LEA leads who can offer that context, which I'll speak to a little bit later in talking about the report that is going to be published and made public regarding the data that was collected over the past several months. When looking at the data, we can see the three largest spending categories you see here. Improving the learning environment, a little over 50 million. Enhancing student enrichment experiences was the second largest investment as a state. And then third would be the social workers, mentors, and counselors. So not limited to those titles, but the positions that really fall under the umbrella of student support services are where those positions often appear. This next slide here gives you a summary, highest to lowest. So of all of the 13 wraparound services, this is where all the investments landed according to the data that was submitted. I'm not going to read through all of them, but you can see the first three I mentioned in the last slide, followed by extended learning time being the fourth largest investment. And you can see the remaining investments moving down the list. Again, whether it be positions, partnerships, professional development, supplies and materials, all of those things were noted as investments under any given wraparound service, which is what makes it so interesting to see how we can implement the strategy, how we can maximize the investment of funds, how we can leverage this opportunity between our partners and the work we're doing at the school to support our students and our families.
Hey, Derek, just
yes,
since it's the largest line item for learning environment, like what are examples of things that would fall into that category?
So learning environment is probably one of the broadest categories within the wraparound services, but it is inclusive of positions. So in some cases, a school or district reports social emotional learning coach might be someone who helps improve the learning environment. Professional learning that is provided to staff around trauma-informed care could be an investment that falls under improving the learning environment. Having safe spaces or spaces where students can de-escalate. In some buildings that have the luxury, they have entire rooms. In other schools, it might be a corner of the classroom, but having things, materials, and resources so that students can de-escalate. So it varies in a variety of ways, but it's definitely the most broad wraparound service with the largest investment. Did I answer your question?
Yeah, I mean, I think there's, it's hard because it is in some ways kind of a catch-all, but it's also the largest the largest line item. So, I wonder if at some point, even just like breaking down and categorizing that a little bit more, so there's a little bit more definition might be helpful, but.
Yes, yes. And I'm going to speak to that on the next couple of slides. That
Sure.
opportunity is definitely there for us.
Yeah, thanks.
So to the point that was just raised, what we shared in those past slides was just a high-level overview. But in the coming weeks, there's going to be a dashboard that's developed that AIB, LEA leads will have access to that breaks down not just by LEA, but by individual school, all of the data that was collected over time. So to use the example that was just shared, you'll be able to filter out specific wraparound services by school and then expenditure categories. So if it was heavy on positions, that would be indicated because it falls under salaries and wages. If it was heavy on equipment, that would be indicated on there because it would fall under equipment. But there are budget objects where these expenditures were recorded that, again, can be broken down at the state level, at the district level, and at the individual school level. In addition to breaking down the data in that way through the dashboard, there's also going to be a report that provides not just a summary of the data that was collected for each LEA, but in addition to the summary, which is meant to be a narrative, we're working with our community school leads at each district to offer perhaps some context or additional narrative that can tell the story of their unique LEA and what their experience has been implementing the strategy. We strongly believe that those doing the work in your respective counties are best positioned to tell that story. So rather than have a document that is just full of numbers and charts, have the opportunity for a qualitative piece about the work happening with implementation. That too is going to be shared with AIB and made public in the coming weeks. Looking ahead a little bit, I believe I've shared with this committee previously, but as a reminder, we are currently partnered with communities in schools, and we're really working with them to strengthen our data collection processes. Recognizing last spring, summer, and in the fall even, was the first time we had that level of data collection, but as we look to strengthen those processes, we're going to be working with them to develop some of those systems and resources to, again, strengthen those processes. The systems and resources will be a part of a broader effort to provide professional learning that we can offer throughout the state that supports those doing the work on the ground. Our intention or aim is not to make the work harder or put more work on those doing the work within their communities and in their schools, but to support their efforts and streamline processes, just given the added expectations that have come particularly over the last 2 years or so. Lastly, all of this is going to be in alignment with our multi-tiered systems of support. That is a framework that was developed and shared by some of our colleagues at MSTE, but obviously it aligns closely with the work of community schools. So really grounding our professional learning in our supports in how Maryland is implementing the community school strategy across the state, using the tools and resources being developed and presented to other school-based leaders who may not be directly involved with community schools, but to have some consistency in terms of messaging in regard so that we're not working in silos, but working as a collective to improve outcomes for our students. Everything we do, I think it's important to bring up in this space is done in collaboration. It's really our effort to demonstrate and walk the walk, so to speak, walk the talk, if you will, of what we want our community school leaders to do. So with that being said, we really rely on our community school leads, such as Hope. We really collaborate in a variety of ways with Ellie and Dr. Schiller. So, we try to model that behavior because ultimately those closest to the work can provide the best solutions. and those using the tools and resources being offered can be very informative in regards to what we're designing and delivering. So the insights and the feedback, we welcome that. We seek it out even. And one way we do that is through this directors work group, which meets a couple times a year and really shares insights and informs some decision-making on the bigger initiatives when things are coming down from our agency that are relevant to community schools across our state. Hope, I'm not sure how I'm doing on time, but that is like kind of the halfway point, because from here we're going to shift to the countywide implementation plans. It's a little fewer slides, but I welcome any questions anyone might have about the reporting data and the reporting processes that we just discussed.
Committee, is there any questions? And actually, you're perfect on time. So
Okay.
we're good on that one. Is there any questions so far from anyone? All right, no one saying anything. You can keep going.
All right. So next, we're going to take a look at the countywide implementation plans. Again, this is a new legislative mandate for any districts that are opting to reserve a portion of their concentration of poverty funds for centralized supports. This came about as a result of House Bill 504 last year, and based on the language in the legislation, there were all but 4 LEAs that were eligible to opt in for this, for reserving funds. And if you reserve those funds, you are then opting in to developing a countywide implementation plan. You can see Calvert County, Carroll County, Queen Anne's, and St. Mary's. Many of their schools, many of them just had schools become eligible within the last couple of years. And again, they just did not meet that eligibility based on the way the legislation is currently written. In order to develop this framework, we sought feedback from some of our largest districts, starting with Baltimore City, Baltimore County, and Prince George's County, primarily because they had been practicing, had already adopted the practice of, I'll say, reserving a portion of funds for that centralized support, whether that be specialists or resource teachers that support almost in a coaching model, a cluster of schools, which is common now across other districts, or the fiscal support that was needed just to manage the grant itself and the variety of expenditures coming from a variety of schools. So we collected, we gained insights from those larger districts, but also sought feedback from our directors work group that I mentioned a little bit earlier. Really try to create a space where we can not only share experiences, but ask questions before providing final guidance around the development of these plans. Lastly, we offered a variety of technical assistance sessions to not just roll out the implementation plan process, but what to expect in regards to here's how to complete the document, provided a level of leeway or latitude. So, we just offered the guardrails and left our community school leads within each district to develop a plan that worked for their districts, their needs, and highlighted the assets that may already be established within that LEA. So that framework includes the elements that you see here. Again, these are each of the components, if you will, of any given district's countywide implementation plan. The bullets that you see in bold print are lifted directly from the legislation. The executive summary and the professional learning strategy are just meant to bookend that requirement, but do it in a way that is meaningful, effective, meant to be more than just a checkbox for compliance, but really drive implementation of the strategy within that given district. So of the 21 LEAs, which includes the Seed School of Maryland, 17 have developed and submitted a countywide implementation plan for their community schools. You can see the community schools that, although eligible, did not submit a plan, at least for this year, but in communication with them, we do anticipate that they too will be submitting plans on behalf of their eligible schools within those respective districts. So the large majority, which was not unexpected, have developed these countywide implementation plans that support their efforts to implement the strategy, whether they're supporting a year one school or a school that's been implementing since the inception of the blueprint or even before. It really is meant to be individualized and not just prescribed, which is why we wanted to provide that opportunity to, again, provide the guardrails, but what makes sense for your district's needs. A couple of trends or themes that we found in looking at those plans that were submitted. The large majority of LEAs have at least a goal to address chronic absenteeism. We know this is a statewide goal, and it's good to see that our community schools across the state are contributing to that effort. Access to mental and behavioral health is, you can see nearly 100% of LEAs have a goal in their countywide implementation plan that addresses this need, whether it be through partnerships, which it sounds like we're going to hear a little bit more about later in this presentation, or it might be through positions, adding additional staff members to the school, or who can at least work in the school to support students and their families. Shared partnerships. So there's a lot of a common partnership amongst the community school districts with like the Maryland Food Bank and other local providers. We observe or see that many newer community schools in particular, when just starting implementation or conducting their assets and needs assessment, a common thing we find is that these schools are looking to either establish a food pantry or provide some sort of weekend backpack program, or even develop like a multi-purpose or resource room where families and students can get some things that they may be in need of, having a fixed place, a regular place within the school. We see that frequently. And then lastly, the professional learning. So all of the professional learning strategies in some way are looking to address family engagement and equity. So all of this tracks with not only what we see across our state, but with when we think about implementation of the community school strategy, when we think about some of the common challenges that a lot of students and families are facing across our state, our community schools are keyed into a lot of those areas. And that brings us to the end of this presentation regarding the reporting and the countywide implementation plans. Again, we always welcome questions and or the opportunity to talk more, collaborate more, make connections to support the work of our school leaders doing the work in schools and districts. So welcome any questions anyone might have, but here's our contact information if you'd like to follow up and reach out to Jenny or myself.
Thank you, MSD representation. Are there any questions from the committee? I won't take up any because they know I send them questions throughout the year as someone who had to fill all this out. So they know me too well. I will say one of the best things about finally having a reporting tool is to level set across the state. It also demystifies anybody's assumptions of what is happening in schools or what is the need in schools. That chronic absenteeism, sometimes some people make assumptions of what they think is a reason why a child is out of school. And then when you find out, you will probably get a very different idea of what is happening in a community. Some communities, it could be as simple as there's no safe way for me to walk to the bus stop during the time that they tell me I'm supposed to be at my bus stop. Then you can reach out to your county government to talk about what it means about partnering to support your students across your county. There's also been things as simple as mental health, and not mental health where it would need to go into needing insurance and ongoing supports. But we forget that there's a tier one of just taking care of oneself mentally. And so just giving them someone who's a trusted adult, someone for them to check in with, has been very powerful. But I think the tools aligned, the state, and I know that we will refine them as we continue to go through the blueprint for Maryland's future. But one of the main things with community schools is I think it finally gave us the baseline that we needed to start not judging, but grading ourselves on the impact of our work and not just the activities of our work.
Mhm, mhm.
Any other questions for our team, any committee members? If not, I'm going to keep going. We're good on time, so no one has to worry about it. So the next group I have coming up is here for the Consortium on Coordinated Community Supports. This is actually an initiative that was provided from our Governor Wes Moore in the legislative session. And we have Megan Brown, who is director. It says Mark, I don't see a Mark, as executive director. And then we have an overview of Maryland Community Health Resources, commission structure, student impact data, and grantee highlights. So I will turn it over to those that are on to introduce yourselves, and then let us also know about this consortium on coordinated community supports.
Sure. Hi, I am Jen Clatterbuck. I am the commission administrator. Unfortunately, our executive director, Mark, is unable to join us today. With me is Megan Brown, the consortium director, and Lorianne Moss, who is our program manager. Megan?
Yeah, absolutely. Thank you so much. Thank you for the invitation to present today. I also wanted to share that we have one of our grantees here today, Megan Keeley from Thrive Behavioral Health, are going to share some really personal stories at the end about how this work is impacting students here in Maryland. And so I'm going to go ahead and share my screen. 1 second. Are you able to see the presentation, or are you just looking at my slides?
Seeing your slides, I think you need to hit the presentation button.
Yeah, I'm gonna switch screens. Give me 1 second. Okay, hopefully you're seeing it correctly now.
That looks good.
Okay, great. Thank you so much. I'm actually I'll walk through the objectives really quickly, and then I'll hand it over to Lorianne to get us kicked off, and then I'll go through a little bit more information about our data. So to start, Lorianne's going to talk about an overview of the Consortium on Coordinated Community Supports. We're going to go through a lot of information about the impact that the consortium has had in just a short period of time. And then again, really, really excited to have Keeley and Meg from Thrive Behavioral Health with us here today to talk about the impact that they're having in their communities. Lorianne.
Megan, if you are advancing the slides, they are not.
There we go.
There we go. Beautiful. Beautiful. Great. Thanks. Thank you, Megan. Thanks, everyone. It's great to be with you folks today. It's wonderful to hear the community schools work, which is just so aligned with what we're doing. We'll come back to that. But thank you all for having us here today. As we've discussed, the consortium is part of Pillar 4, which is why we're all here today, for making more resources for students to be successful. The consortium is very focused on behavioral health and wraparound services. And it's unlike community schools, it is really for all students, all schools, pre-K all the way through grade 12 statewide. So we are looking at all of the public schools in Maryland. The consortium is made up of 25 members appointed from a mix of different folks from the governor, the legislature, and some stakeholder groups. So I believe our next slide perhaps will show our membership. We're really pleased that one of our members is here today. Derek Anderson is one of our members, bringing that community school perspective to the work of the consortium regularly. So we really appreciate Derek. You can see this is a great list of folks. It's interdisciplinary. You've got behavioral health experts, education experts, We've got Board of Education, local health departments, principals, just really a broad array of people, and it's wonderful to bring that multidisciplinary approach to our work. Great. So the consortium has 12 statutory objectives that we really try to keep in mind as we implement this program. I perhaps won't read through all of these. We'll talk about them a little bit more in the slides. We might look at number 1 is supporting that development of coordinated community supports partnerships to meet student behavioral health and other needs. So we're really tasked with creating partnerships throughout the state, and we'll talk about what that looks like through the collective impact model. We are number 5, we're very committed to making sure these supports are holistic and coordinated with other youth serving agencies, community schools, and others. Number 6, we are very intentional about ensuring that grant funds are not paying for things that could be supported through things like Medicaid and commercial insurance. So we're really using grant funds for activities that cannot be paid for in other ways. I might point out number 10, geographically diverse plan to ensure access to services within a 1-hour drive. So again, this is statewide. This is all the schools, all the kids across the state. 11 and 12 talk about accountability metrics, and Megan will come back to those, I think, at the end of this presentation. So let's go ahead and move to the next slide. Great. So the consortium has 4 subcommittees. First is our framework and RFA subcommittee that really considered what this statewide framework, these partnerships should look like. We have a data subcommittee led by Larry Epp. We have an outreach subcommittee. Again, when you're trying to make a program statewide, that really entails doing quite a lot of outreach. So we do that throughout the state. And 4th, our best practices subcommittee has been looking at recommending what are these evidence-based approaches that we can really promote through this work. We are also very intentional about getting input from the public. We've had a number of public comment periods to ask, for example, questions about the overall program design, what kinds of services should be available, what's needed, what evidence-based programs should be used, what kind of data should we collect, et cetera. So we did these 4 rounds of public comments. The comments came in and then they were discussed by our subcommittees and really helped to inform the different funding opportunities, different reports, and a lot of the work of the consortium. Thanks. Next slide. Great. So we call this our org chart. This is a very collaborative effort, and we want to try to explain how this all works. So the consortium itself, the 25-member group, really develops that policy framework and came up with the overall design for the program. The CHRC, the Maryland Community Health Resources Commission, that's who employs Jen, Megan, and myself, acts as the fiscal agent for the consortium. The CHRC issues the RFAs, issues the contracts, does that contracting piece. Right in the heart of everything, of course, is our local school districts. Local school districts need to support these programs that we're doing. We can't enter it into a grant agreement with someone who the local school district does not want to work with. So we've required letters of support for applicants. Obviously, there's a great deal of ongoing collaboration and training that we provide and do with the local school districts. Again, looking at the community schools as we develop we also are doing asset maps and needs assessments and whatnot to make sure the right services are going to the right places. On the bottom right, you see the National Center. That's the National Center for School Mental Health at the University of Maryland. They are a terrific technical assistance partner. They provide a lot of the trainings to both our grantees as well as to some school employed staff. They work with us on every aspect of the program. We have monthly technical assistance sessions that actually our providers now, they can get CEUs for attending. So we have a real mental health curriculum that we're working through that the National Center leads that. And again, so many things. And all of this supports these community support partnerships, which we'll get into a little bit as we continue the slides. Great. So in designing this program, we really looked closely at these legislative requirements. So this is language that we've pulled straight out of the Blueprint bill. What is a community support partnership? A partnership should be formed, should support an area, may have these partnership coordinators. It needs to be holistic, youth guided, and family driven. And so we've landed on a collective impact model where there is a local hub that coordinates the services, typically in one school district, though we have some that are more regional that maybe serve 2 or 3 or 4 or 5 actually rural districts. But in some of the larger school districts, it's really one partnership for one school district. So there's the hub that coordinates these services, and then they work with a number of service providers. And the hubs are responsible to coordinate that delivery of services, to work with us on data collection, very, very important. We're getting a great deal of data from our service providers, as well as they act as the fiduciary. So the CHRC enters into a grant relationship with the hub, and then the hub enters into that relationship with the service providers in their communities. And again, it's those hubs that they do the needs assessment, they do the asset map, they come up with the plan for what really makes sense for their school district. Next slide. So we have been working to implement this plan statewide. So the map shows you the places where, going into this next round of funding, there will be a full community support partnership. And that means you've got a hub, you've got your service providers, everyone's working in concert with each other. In the counties that are not shaded, the counties that are in white, we are funding services in those counties directly. So those counties are not being left out, but we are funding them directly, as the local coordinating bodies just need a little bit more time to get set up and to complete, again, the needs assessment, asset map, selecting the service providers, figuring out the plan that's going to make sense for their communities. So going into FY27, we've hit 20 out of 24 jurisdictions with these full community support and partnerships, which we're very excited about. And hopefully then the following year, the whole state will be covered by these partnerships. So very exciting. Great, I'll turn it over to Megan.
Thank you so much. As Lorianne mentioned, we have the 12 statutory objectives that were outlined in the Blueprint bill. We take these objectives very seriously, and we're actively tracking progress towards each of these. As she also mentioned, we're collecting a lot of data. I will give a little bit of a shout out to our grantees who are doing an incredible job of tracking and reporting their data to us on a quarterly basis. I'm looking to Keely and Meg because they've got reports due on Sunday, so I'm grateful for them being here, today. I'm not going to go through all 12 just in the interest of time, but please know that the full statutory scorecard is posted to our website, and we're happy to email it to this group as well if there's any interest. But just to walk through some of the key things that have been happening over the last 1.5 to 2 years. As Lorianne mentioned, one of our objectives is to develop that coordinated community supports partnership model. As of this current grant year, we have 7 full CSPs funded representing 12 jurisdictions. And in a couple slides, I'll kind of walk through the map of how we got to this point. And then she showed in the next funding cycle, we anticipate 20 out of 24 jurisdictions will be represented by the full community supports partnership model. There's a lot of technical assistance being provided not only to our grantees, but also to local school systems to support positive classroom environments and to close achievement gaps. The National Center has worked very hard in training almost 6,000 school-employed staff in 15 evidence-based programs. I'm going to give you a little bit more detail about those programs in just a moment. We're providing expertise and best practices in delivery of behavioral health and wraparound services. We have expanded this grant program statewide. We have services up and running in all 24 jurisdictions. A little over 1,600 community providers have been trained in these evidence-based programs. And we're providing ongoing implementation support to the grantees to make sure that the programs that are being implemented are really high quality. So the grantees will go through their initial training around a specific intervention, and then there is continual follow-up from the National Center and just to make sure that the intervention is being delivered in a very thoughtful and high quality way. Okay, we've already talked through the statewide framework for partnerships, but I will mention that under this current grant year, the 7 full community supports partnerships are serving 324 schools already this year. We're really excited about that. We're going to see that number grow as time goes on. We're ensuring that supports are holistic and coordinated with other youth serving agencies. So one of the benefits of the community supports partnership model is that each jurisdiction is required to look at the existing resources within their jurisdiction and make sure that consortium funding complements those and doesn't duplicate. So they're required to create or to draft an asset map to identify youth serving resources within their community. They're required to work with other local youth serving agencies to coordinate these holistic services. In a lot of instances, we have lots of other youth serving agencies serving on advisory boards for the CSPs. I actually had one jurisdiction CSP tell me that with this model, this is really the first time all of these agencies are working closely together. This model is breaking down silos across the state. It's really incredible to watch. And then CSPs are encouraged to seek student and caregiver input on services. This happens in lots of different ways. Each jurisdiction does it a little bit differently, but some are hosting focus groups to get input from students and families on services. Some have students and families serve on advisory boards and governance committees. There's lots of different ways that this input is being provided to the full CSPs. And then the 6th one I'll go over is expanding available supports by maximizing Medicaid and commercial insurance. So just starting this year, we've hired a Medicaid consultant to assist grantees with maximizing billable services. Not only are they doing kind of global technical assistance to all grantees, they're also meeting one-on-one with people who, if they haven't started billing Medicaid, it's to help get them set up to bill Medicaid for behavioral health services. Or if they're already billing, it's to look at their current practices to make sure they're billing at the maximum that they're able to bill. Okay, I'm going to go back in time just a little bit and give you an overview of the first year of the grants and the impact that it has had. Though it was an 18-month grant cycle, services really focused on serving the 2024 to 2025 school year. There were 2 things kind of happening concurrently. So the first RFA was focused on funding service providers in every jurisdiction in the state. There were 127 programs that were funded at 110 million total. And then at the same time, the infrastructure for building that pilot hub and full community supports partnership model was started as well. So the second RFA focused on funding 10 pilot hubs. The only organizations within each jurisdiction that's eligible to apply to be a hub or a CSP is the local behavioral health authority or the local management board. And there have been significant technical assistance for those pilot hubs to help them get ready to be a full community supports partnership in their jurisdiction. All right. As Lorianne mentioned, there was a lot of really thoughtful, there's a big thoughtful process around the selection of the priority evidence-based programs. There was a significant public comment process. In addition to that, we had expertise both from the National Center and from subcommittees that really selected 15 priority evidence-based programs that would really address all of the major behavioral health concerns that people are seeing here in the state of Maryland. And the different types of topics include prevention and mental health awareness, depression and anxiety, suicide prevention, substance use prevention, trauma, that early childhood programming, the pre-K age, as Lorianne mentioned, summer and after school programs, and family support. And you'll get to hear more detail from Thrive about the different work that they're doing in some of these areas. I will also mention that we also support a multi-tier system of supports model. So in addition, we have the tier 1 services, which is really kind of school-wide or education prevention work. We also have tier 2 services, which is the small group interventions for people who just need a little extra support. And then there's the tier 3 services that is the more traditional one-on-one therapy for students who need really intensive support. We are very proud of our year 1 outcomes. As we've mentioned several times, we're collecting a lot of data. We have been able to demonstrate expanded access to services in the first grant year with almost 137,000 unduplicated students served in just the first year, 86% of Maryland schools. We've increased the capacity to deliver services with the hiring of more than 700 new behavioral health workforce members. So keep in mind that those workforce members include not only clinical professionals, but also support professionals like peer navigators and community health workers who also have a pivotal role in helping to support students and families. We've achieved quantifiable outcomes. You'll see in the boxes on the right, 80% of students who received a preventative service demonstrated a desired behavioral health skill. For those people who are receiving the more targeted services, that's the tier 2 and tier 3 services, we had about an average of 64% of students show improvement, with an additional 26% maintaining behavioral health outcomes. We are really proud of both improvement and maintenance. We want to make sure that no kids are deteriorating, so we focus on both of those metrics. And then, as we've mentioned, we began to build the Community Supports Partnership Framework. Okay, so I'll talk a little bit about year 2, which started July 1 of this year. This is the current grant cycle that we're in now. We are funding 154 service providers across the state of Maryland, 97 million total. As we mentioned, there's 7 full community supports partnerships funded, and also 9 pilot hubs. And 7 of those 9 will be applying as a full community supports partnership in the next funding cycle. We already have some data to report for this year. We're really excited to share this with everybody. Please keep in mind that the data presented here is just from the first quarter of this year, so July through September. We are collecting Q2 data in just a couple days, so these numbers will be updated as we validate and analyze that data. We're very proud that more than 94,000 students have already been served. That's with just about 1 month of school being open, so that's a fantastic achievement already. And of those 94,000, 31,000 have received services beyond the school-wide events, so those are more targeted services. 70% of Maryland schools are already receiving services, and we know this number is going to go up as time goes on, and we're really, really proud of our 90% satisfaction rate. I mentioned that we have an RFA open currently. We released it just this past month. Proposals are due in just a couple of weeks on February 11th. Awards will be made in the spring, and that funding cycle will start on July 1, 2026 and end on June 30th, 2027. The last thing I'm going to mention is that in addition to our statutory objectives, the consortium also identified 4 primary goals. The first one, which is really core to our mission, is expanding access to high-quality behavioral health and related services for students and families. Also to improve student well-being and readiness to learn, foster positive classroom environments, and then really looking at that sustainability piece, promoting sustainability through revenues from Medicaid, commercial insurance, hospital community benefits, and other funding sources. We're tracking progress towards these goals as well. I've gone through, pretty sure, every single one of these metrics already, so I'm not going to walk through each one, but I will mention that on the sustainability piece, we also have had 22 grantees who are able to leverage additional funding sources, around $5 million, and we're really talking through ways to better capture and demonstrate that information. So we'll have more info on that hopefully in the next year. Okay, I am going to hand it over to our amazing Thrive team who are implementing these services.
Hello, I'm Meg Pantelis. I'm our school-based mental health program manager. And also here is Keely. She is one of our founding partners and directors. So we're going to largely speak to the impact that the CHRC funding has granted students around the state through Thrive. Thrive is really fortunate. We were an original grantee and we still are. We're currently in 6 jurisdictions. So Anne Arundel, Baltimore, Harford, Howard, Montgomery, and Queen Anne's. Skip. Thank you. Here's a brief overview of the services that we provide in these 6 jurisdictions. We have early childhood behavioral intervention. This uses a team of a clinician and a therapist aide to support students who have significant maladaptive behaviors. So these are the kids who are at really high risk of being removed from the public school system. This is in Anne Arundel, Baltimore, Hartford, Howard, Montgomery, and Queen Anne. So we offer this across the board. We have substance use prevention and intervention. This is where a clinician partners with the school, small groups, and individual students to reduce, to reduce substance use. We have a student support specialist. This is in Hartford County, and this is really kind of whatever the school needs. So this can be a bit of a jack of all trades and respond to each school environment individually. With the funding, we've also expanded access to treatment by reducing financial barriers to qualifying students, increasing school collaboration, so we're able to partner with school staff to improve student outcomes, and increase school staff training. So we provide targeted trainings that really focus on students and mental health. This is a bit more information about our ECBI teams. So our ECBI teams provide 3 tiers of support. So we use the multi-tier system of supports as well. At the tier 1 level, each classroom and school really benefits from the ECBI services because they are providing things like classroom management skills, feedback, and community resources that are really benefiting the entire school population. We provide targeted small groups for social skills, parent support. We will use expressive modalities like art, music, really whatever we can to kind of reach students. And then at the tier 3 level, every single ECBI student receives an individualized care plan that's going to support them in the home and the school environment. We really seek to kind of bridge the gap between school and home.
Hey, can I also share with ECBI, we're really grateful to this program because we've also this year been able to train our ECBI clinicians and the therapist aide in family checkup model and roll that out, which is an evidence-based practice to support families as well. So that's another component that just been really grateful for, and families are really grateful for.
Yep. And then this is our substance use prevention and intervention, our SUPE program. SUPE is primarily at middle and high schools in the counties that we're offering. We provide a lot of tier 1 support. So they will do things like lunch events that are available to all students. They can partner during assemblies. They can participate in school-wide events, community resources. I mean, anywhere that students and families are, our SUPE clinicians can be there and providing psychoeducation to reduce risk. At the tier 2 level, they do a lot of targeted small groups. These are primarily for our students who are at really high risk of using. They may not be using yet, and this is very prevention focused. These are typically wellness groups. And then at the tier 3 level, we will provide individual supports to students, typically those who are already using, although we can also serve students who may be at really high risk. This is a really big piece, this expanded access. So largely what the CHRC funding has done is it's allowed us to really bring these programs more widespread. So most of these programs started in Anne Arundel County, funded directly through the school system. And they were so successful that a lot of other counties started asking for them, but we had no way to offer them. So thanks to the CHRC, we have been able to significantly increase all of our programs. We have, in our CHRC districts, we have increased by almost 2,100 students, individual students. That's a 73% increase. And this is just through November of this past year. ECBI alone has served 64 tier 3 students, which is almost 51% increase. Their caseloads are very intensive, so they're very small. This is a massive increase. Co-payment support has really helped decrease the barriers and paneling nuances. So now more students and families have access to mental health treatment. We always bill insurance whenever we can. We bill both Medicaid and private insurance. So we always want to try to, bill where we can. But unfortunately, the reality is that a lot of Marylanders remain underinsured. So even if they have health insurance, they may not be able to pay their copays. They may not be able to meet their deductibles. And so it's still a barrier, even though they have the insurance. Staff training and collaboration, this really allows us to just provide kind of more comprehensive supports to students and families. This, where appropriate, we're able to connect with school counselors, teachers, administrative staff, and really make sure that everybody's on the same page and being collaborative and providing care to students. Thrive works with 4 full CSPs and 2 partial CSPs. And actually, the 2 partial CSPs this year will be moving on to full community support partnerships next year. We have found the CSP collaboration to just be really, really beneficial. It kind of just helps bridge a gap for any barriers that may exist. Anytime that we may have difficulties, serving students or operating within a school district, the CSP really kind of just helps troubleshoot whatever's going on and create a solution quickly. And this kind of just speaks to some of the National Center that we've talked about earlier. So the CHRC has also partnered with the National Center. That's who helped us develop our EBPs, the EBPs that we're using. So we were able to work with them to identify which EBPs are going to be best for each program. This allows us to provide really individualized support. So we use Unified Protocol. This is going to be for our typical offsite therapy. We use the SBIRT and GAIN. We're using this for our substance use prevention and intervention program. Every single client receives Stanley Brown safety planning, and our ECBI program receives Family Checkup, which is a very caregiver-centered, evidence-based program that really seeks to modify behaviors, but in a way that's very strengths-based. I think one of the things that's most remarkable about the CHRC and the way that it operates is that it's very data-driven, but still client-centered. And that is really unheard of. Usually it's kind of one or the other. You kind of wait for something to happen, you collect the data, and then you react to it. It's remaining client-centered. It's providing all of the services that we have been providing and that we want to provide to the students. And it's tracking the data along the way. And it's really successful. Actually, back in December, we were at the School-Based Mental Health Conference, and this doesn't exist anywhere else. Like nowhere else in the country does this exist. It's really, really remarkable.
Thanks, Meg. How are we doing on time? Are we okay for time for a few success stories?
Yes, you're good.
Okay, great. Okay, great. So these programs are incredibly important, and I think these success stories really bring that to light and kind of share some of them across the programs. I will tell you, on a day that I'm finding really, really hard, maybe like the work is hard, I walk up to our intake coordinator and I say, tell me about the people we're impacting today that you've heard from. I talk to these families, that it was mentioned that reporting is due this weekend, and I'm going to be honest with you, sometimes I love doing the progress reporting. Maybe less the M&D reports, but the progress reporting, because we do gather the success stories and bring them together, and they're really great to hear. So for this particular success story here, this is about our expanded access and co-payments. This is a parent who had their children enrolled at Thrive, and they were in therapy services. One of these children, very high risk for suicide. They lost Medicaid coverage. Historically, that would mean that we don't just drop people, but we would be trying to find access and transitioning them to other care. This program, the father went through the financial hardship process, and he did, based on those standards, he was able to qualify for his family to get co-payment support because they were then on private insurance. And if we think about a child that is high risk for suicide, that's typically not once a week therapy. That's typically twice a week then at that point that they're going to need it. So those copays really add up. I think this is an example. Without that care, one of the high risk, the risk factors for suicidality can be a disruption in treatment. So the fact that this child was able to remain in consistent treatment, quite possibly, it is not a big leap to say saved a life, or at least led to that, which is incredibly cool. How about the next one? So our student support specialist up in Harford County. So she is at Havre de Grace High. They also pull her to work some in Havre de Grace Middle, and she is there. There is a portion of her day that is that she clocks out essentially, and we bill her services, her tier 3 individual therapy services, to insurance when she can. But she is also in the building for when for these other tier 1 and tier 2, sometimes tier 3 services where they're not able to be billed to insurance. So here is someone, since Miss Jaleesa started, I feel like I have a safe space to go to. I go to her office every day. I don't have insurance, so I wouldn't be able to see a therapist. Miss Jaleesa helped me see other points of views. I get bullied at school, and she helped me with resources and tele-admin. I don't feel as anxious as I used to feel, knowing that I can go to her office for a second when I need to. I don't feel as afraid being at school. Sometimes kids don't need a 45-minute therapy session. They need a quick check-in. And this is really able to expand that. There's a comment there that you all can see from a staff member. We also, this funding has also been really incredible because Jaleesa is clocking out for part of her day, we had some extra hours. So when there was a really tragic event at a high school, we were able to use her, essentially her hours in a very similar service, but at another school that did not have the supports, where we were able to put intensive supports together for a soccer team that had lost a member, supports like on the fly supports to staff that were kind of trying to navigate their own grief while supporting their students through it. It was really quite phenomenal. This would not have happened without this program and these funding. It absolutely would not. That was a community that was deeply impacted by this. We can go to another one. Substance use prevention and intervention. So there are activities happening all the time. They go into classrooms, they go into lunches. This particular one back in December were 322 students. They really come from a harm reduction strategy and try to do really fun activities. So they gained insight into physiological and mental health changes. They explore resources. So what resources are available and how can you cope? So some student feedback included, I learned about what it is in vape smoke, what leads to addiction and how can it affect your goals. I learned how drugs can learn long-term problems. The really cool thing about this program is that, yes, there are these tier 1 kind of high visibility events happen, but then those people are also available to do more targeted supports for the kids that need them. So it's not like one program is doing these, coming in and doing an education event, and then there's another counseling service where it's like some other stranger, like these kids say, oh, that person, yeah, I could talk to them. I feel I would trust them, which is a really cool thing. Another one. Our ECBI programs at the beginning of the school year, the client would become upset. He would hit, push, kick desks, have to be escorted out of the classroom due to his behavior. The child now still becomes distressed, but he's able to use more safe coping skills and utilize short breaks to give him time and space to calm down. The parents also said that the behavior chart that he brings home every day, he has many smiley faces circled and he's having more good days than in the beginning. In some of these, we are hearing this across the state that these young learners are really struggling. I think most of the jurisdictions we're working in have asked us to at least propose how we can bring those programs to them, which is really incredible. In Baltimore, we just added that program at the end of last school year. This is an intensive program. There are about, I think it's 7 kids were on track to be out of general education setting and have successfully discharged, or will just successfully discharge or end the program by the end of February. And these were children on track to kind of be a more non-public, really intensive, very expensive placements. How about one more? I think there's one more. Oh, that's it. So if you all want more success stories, we can go on and on all day because it's really fantastic. And we're really grateful to be able to partner and to do this work and to have this impact even on the hard days. So thank you.
Thank you. Definitely for the success stories and how the presentation kind of connects to everything around Pillar 4 this afternoon. I have one question, and I guess this would probably be for Lori Ann. When you're looking at all of what the consortium has touched, are there currently any areas that have not received any awards at this time and are still needing some kind of support out across the state, or has every LEA had someone, at least one, maybe get an award?
So that's a great question. So we have services happening in all 24 jurisdictions of the state. Every school district has more than one service provider that's being funded by the consortium right now. And I would say those school districts are integral partners in deciding what are the services they need, who are the service providers they want to work with. So yes, the short answer is yes. We have services all across the state, meeting the needs that those school districts have identified.
And then the next question I have is actually for anyone. Are you seeing anything around the current climate impacting services that you are supporting right now? And if so, is it more people asking for services or more people needing the services but are too afraid to access the services? I'll just keep it at a high level. How about that?
Your question is well timed. So we had an office hours session earlier today. It was a full hour. That's an opportunity for grantees to come ask any question to either the THRC team or the National Center team or other grantees. And we leave it open-ended. And a lot of the time, most of the time we get questions about, how do I fill out my reports or how do I report this expense, et cetera. Almost the entire hour was focused on the impact of ICE and immigration on local communities today and how to be able to continue to offer services and implement services to populations that are afraid to access them. I'm going to actually have Keely and Meg talk about what they're seeing, and you feel free to elaborate on the conversation that we had earlier today.
Yes, I think, one of the things that's important to be good stewards of the funding. These are across the state, Megan, is it $97 million that are awarded to grantees? We want that to be used well. So let's talk about our expanded access service. We want to sit there and make sure that if we are, billing to the consortium a co-payment that they otherwise wouldn't be able to, or for a service that if somebody really need it, no offense to Ravens players, but they're probably making enough they can afford it. We want to make sure kind of somebody who needs it. But because we go through a financial hardship process that is a form that asks for information, it really makes people nervous. So even if people might qualify for that hardship, they get a little bit nervous or a lot nervous, where they just won't fill out the form. And one of the things that we have to do to check whether somebody has insurance is using a social security number. So that question alone is really nerve-wracking. So I think there's a lot of fear about how would a record possibly be used or access that. I think beyond just like that specific nuance, the other providers and what we hear from talking to people about is it's just also this level of a little bit of just compassion fatigue as well that's impacting. I don't think anyone on this call, we're all working in this profession of kind of helping the kids in the community. I think there's a bit of that happening too, where it's kind of, even if there isn't a risk to a particular school today, it's just a little bit of that fatigue from that. So
thank you. Is there any other questions from the committee members? As I see that we have made it to 5:30, I want to honor people's time. Any other questions? I just want to thank you for the very thorough presentation from both sides, because it is really showing Pillar 4 and everything that is supporting Pillar 4 work across the state of Maryland. As we have gone from looking at what is MSDE, what is the consortium. I know Enough Grant ties into some of this as well. And so it's just very nice as a resident of the state to finally see that collaboration and connectivity that will impact students, not just now, but hopefully our communities in the future as well. So at this time, I thank everyone for coming. We will adjourn this meeting today. Just wanted to let everyone know our next meeting is February 24th at 4 o'clock. And our topics on that meeting are multilingual learner work group coming, best practices in teaching emerging multilingual learners, those assets and barriers, and then even seeing some of the positive impact from some of the LEAs that are doing this work across our state. So at this time, we thank you for joining us, and we wish you a safe week. Please be mindful that black ice is hard to see, so we ask for you please to be mindful about being on the roads and taking care of not only yourself, but those that are around you.
Ms. McGuire, thank you so much for the invitation. Also, just wanted to give a plug, the CHRC grants, our annual grants. We also focused on enough areas as well during our last RFA, and probably will again for our current, or for our RFA that's upcoming. So we are all about collaboration.
Thank you. And I appreciate all of you coming. Special shout out to Thrive since you're on here, because yes, you do amazing work in Montgomery County. I hear about you all the time.
Awesome. Thank
I
you.
love Montgomery County. You guys are wonderful.
Great
All
job.
right. At this
Okay.
time, we can stop our meeting for tonight, and we'll look forward to seeing everyone in February.
Thank you guys. Have a good
Thank you
one.
so much.
Thank you.
Wonderful. That was great meeting. Hold on, let me
They went to the end. I was letting them go because I knew that. I didn't realize Keely until I saw her face, but yeah, I have been in a space with her, so I knew the meeting would take itself to the end.
okay.